La Leche League International, The Womanly Art of Breastfeeding. Delve into the world of breastfeeding with the book, The Womanly Art of Breastfeeding, by La Leche League International. This summary explores baby-led feeding, the physical and emotional benefits of breastfeeding, and how to address common complications. Dispelling prevalent myths, the summary encourages moms to trust their instincts and their baby's signals while providing practical advice and support. Readers will gain an understanding of the importance of breastfeeding for both maternal and child health, and how to navigate potential roadblocks with confidence.
The Womanly Art of Breastfeeding. Trusting your baby's hunger signals. In The Womanly Art of Breastfeeding, the key idea is to let your baby lead the feeding process. The book advises that babies should be allowed to signal when they are hungry and when they have had enough. This might mean more frequent or longer feeding sessions. With baby-led feeding, parents do not need to worry about the quantity or frequency of feeds as they will be guided by the baby's needs. If time constraints make baby-led feeding difficult, the book offers alternative advice. Trust your baby's hunger signals and watch them grow as nature intended. Breastfeeding Benefits. Breastfeeding is an ideal nutritional source for infants as it provides numerous health benefits. The balanced nutrients in breast milk cater to the growing needs of the child while protecting them from germs and infections. Breast milk contains immunoglobulin which shields the intestines from allergens and strengthens them. It also plays an essential role in the physiological development of the baby's facial and jaw muscles, resulting in better ear and sinus health. Moreover, breastfeeding helps moms in the healing process after childbirth and delays the onset of periods. The emotional connection that develops between a mother and her child during breastfeeding is crucial in building a strong bond. However, it is essential to feed the baby, irrespective of whether it is through breastfeeding or other feeding options. The key takeaway is that most breastfeeding problems can be addressed, and the ultimate goal is to ensure the baby is fed in the best possible way. Breastfeeding myths unveiled. Women can breastfeed regardless of breast size or nipple shape. With simple adjustments like compressing the breast or using a nipple shield, it's possible to overcome common challenges associated with breastfeeding. Breastfeeding is an amazing and rewarding experience for both the mother and baby. However, it comes with a fair share of myths and misinformation. One of the most common concerns that women with small breasts have is that they won't be able to breastfeed. This is not true as there's no correlation between the size of a woman's breast and the quantity of milk produced. While breast size doesn't affect the ability to breastfeed, the shape of the breast might play a role in latching. If a mother has long narrow breasts, her baby may struggle to latch. Fortunately, mothers can compress their breasts like a sandwich to give the baby more surface area to latch onto. Nipple size is another concern that some women have when it comes to breastfeeding, but having big or small nipples should not be a hindrance. If a woman's nipples are too big, she can encourage the baby to open their mouth wider to fit around them. Inverted nipples are also not a barrier to breastfeeding, and mothers can use a breast pump or nipple shield and massage the nipples to stimulate milk letdown. In conclusion, breastfeeding is a natural process that can be easy for some and challenging for others. However, women should not be discouraged by myths or misinformation. Breastfeeding is possible, and with simple adjustments and tools, mothers can overcome most common challenges and enjoy a fulfilling breastfeeding experience. Overcoming common obstacles to breastfeeding. Breastfeeding, despite its numerous benefits, comes with certain challenges, including pain, low milk supply, tongue tie, and breastfeeding after a difficult birth, which can be overcome with knowledge and resources. Breastfeeding is a natural way to provide your baby with the necessary nutrients for his growth and development. However, it comes with certain challenges that new mothers should be aware of to avoid unnecessary struggles. Pain during breastfeeding is one of the common obstacles new mothers face. You don't have to suffer through the process because breastfeeding should not hurt or injure you. If you are experiencing any discomfort or pain, try changing your feeding position, breaking the latch, or compressing your breast to allow your baby to latch properly. Another obstacle to breastfeeding is low milk supply, which can cause unnecessary worry and stress for new moms. However, it is often a result of misinformation and unnecessary pressure. The truth is, if your baby is gaining weight steadily, producing at least 6 wet diapers a day, and having regular bowel movements, you are making enough milk. If you are concerned about milk supply, seek help from a lactation consultant or support group, like La Leche League, to identify the problem and get the right solution. Breastfeeding after a difficult or traumatic birth can be another obstacle that new mothers face. In such cases, you may need to work with different feeding positions due to pain or surgical wounds. In other instances, like if your baby is receiving medical intervention, you may need to begin your breastfeeding journey by pumping or hand expressing. While pumping or expressing milk may not come easily, your body is designed to respond to your baby's needs, and you can stimulate milk flow by getting as much skin-to-skin contact as possible with your baby and pumping consistently, so your body gets used to producing milk at a certain rate. Tongue tie is another obstacle that can hinder your baby's ability to latch onto your breast comfortably. Tongue tie is a condition where the frenum under the tongue makes breastfeeding difficult. A quick trip to the doctor's office can help snip it loose, a brief moment of pain, to provide your baby with easy access to your breast. In conclusion, breastfeeding has numerous benefits for both mother and child. However, challenges like pain, low milk supply, tongue ties, and traumatic births can hinder breastfeeding. Knowing the right information, seeking help from support groups, and consulting with your lactation specialist can help overcome these obstacles. Debunked breastfeeding myths. Breastfeeding is a common practice for many mothers. However, there are lots of myths and misconceptions surrounding it. This excerpt from a book explores the truth about breastfeeding, from how long to breastfeed to switching breasts. According to experts, exclusive breastfeeding for 6 months and breastfeeding for up to 2 years while initiating other foods is recommended. It is also emphasized that there is no specific length of time a mother has to nurse per session. The idea of switching breasts to ensure the baby gets hind milk, which is believed to be calorie-dense, is a myth based on an observation of breast milk in a bottle where separation occurs. In reality, a mother's breast only produces one type of milk. There is also no need to ensure that the baby gets equal time with each breast in every session. The frequency and duration of breastfeeding should depend on the baby's needs, and mothers should not feel pressured to follow a strict schedule as every child is unique. Breastfeeding Essentials. Breastfeeding doesn't require much, just comfortable clothing that is easy to remove, breastfeeding pads, a comfortable baby carrier, and optionally a breast pump. Most new moms do not need special nursing clothes or a nursing bra, which means that breastfeeding is portable and affordable. Supporting breastfeeding mothers. Partners and family members can provide crucial support to breastfeeding mothers by offering to help with household chores, providing emotional support, and taking care of their nutritional needs. Breastfeeding can be a challenging experience for new mothers, especially in the absence of supportive resources. La Leche League was created to address this gap and provide nursing women with comprehensive support and information. While external groups can help, a mother's primary support network is usually composed of their friends and family, particularly their partner. Partners and family members may wish to support breastfeeding mothers, but they may not know how. This is where they can step in to help. One simple way is by taking care of the mother's nutritional needs, whether by stocking the freezer, grocery shopping, or picking up takeout. By helping with these tasks, they relieve the mother's stress and enable her to focus on nourishing her baby. In addition, partners and family members should be willing to relax about housework and help keep things tidy, but also know when it's necessary to let things slide. Emotional support is just as crucial, as breastfeeding can sometimes be stressful, and mothers might experience postpartum depression or baby blues. Partners and family members can help by being patient, kind, and willing to listen to the mother's concerns and needs. Ultimately, a partner or support group that is attuned to the mother's needs can provide the right kind of support. However, it's also okay to ask for help directly.
In conclusion, The Womanly Art of Breastfeeding offers invaluable insights and advice on the beautiful journey of breastfeeding. Covering topics from baby-led feeding to addressing common complications and myths, it encourages new moms to build a strong bond with their baby through this natural act. The book reminds readers of the numerous benefits breastfeeding provides to both mother and child while emphasizing the importance of support from partners, family, and organizations like La Leche League. Ultimately, readers will be equipped to embrace breastfeeding as a powerful, beneficial, and attainable part of their parenting journey.